Good evening. My name is Noah Webster, and I'm presenting a project on bullying in nursing. Workplace bullying has been an issue, especially for nurses, for a very long time. Statistics tend to say that most bullying occurs with new nurses or new graduate nurses. As much as 90% had experienced some sort of bullying a coworker incivility. As a result of bullying with nurses, nurses can experience burnout, and unintentionally place their patients' lives in danger. They can also not want to come to work, stressed out, have emotional, psychological, and physiological manifestations of bullying. Obviously, as patients come to the hospital, they expect to have the highest quality of nursing care, but a bullied nurse cannot deliver that care as expected from the patients. Um, Student nurses even say that they often feel ignored by senior nurses or the nurses that they may be assigned to during the day because they're not acclimated to being a nurse as of yet. Nurses Nursing is one of the only um, professions of which you can't really leave your unit to kind of decompress for the day or trying to take a breather after events or either get away from your aggressor. Um, you may notice bullying as a difference in the personality of the nurse or a decrease in patient safety or safety and care or an increase in adverse patient reactions. There's been even a Joint Commission Sentinel Event Alert number 40 that says, and I quote, intimidating and disruptive behaviors can foster medical errors, contribute to poor patient satisfaction, and to preventable adverse outcomes and increased costs of care. To assure quality and to promote a culture of safety, healthcare organizations must address the problem of behaviors that threaten the performance of the healthcare team. Now, who's mostly doing bullying? Statistics show, according to Harrison Smith, that senior nurses and charge nurses are responsible for most of bullying. And the unit that where bullying mostly occurs is med-surg unit, followed by critical care. Now, what can we do about that as nurses? So we have to take control into our own hands by creating projects such as performance improvement. So ways that we could reduce nurse to nurse bullying would be to create a zero tolerance for bullying organization wide, annual training for nurses and leadership, anonymous nursing surveys, human resources open door policies, support groups, and feedbacks at all levels of the organization. So, the most conclusive way to get feedback would be through an anonymous survey of which nurses feel like they can express themselves freely without fear of retribution or any type of retaliation. So the responsibility of the PI project would basically be the senior leadership, and they could create a culture of anti-bullying. They can set the tone. The nurse manager would also be responsible for reporting back to senior leadership, serving as a mentor and a guide for implementation of anti-bullying, and communicating successes and failures so they can go back and fix whatever issue there is with the new anti-bullying organization or the policy. And as a follower, which would be floor nurses, they would be able to give feedback regarding the culture of bullying, as well as any issues that may be occurring. So the survey that I would give based on my research would be the Negative Acts Questionnaire, which is an item that's used to look at workplace bullying and destructive behaviors. So nurses in all areas would be able to take their survey online, and based on the results, once the data was collected and condensed, the information would be placed for all nurses to see and easy to read graphs and bar charts. So the results would be conclusive of who would be responsible for most of bullying, which areas experience the most bullying, how many times a month they feel bullied, how many adverse patient outcomes occurred as a result of bullying, and the types of bullying experience as well as the emotions that the nurses shared who were bullied. And from there, we can evaluate the results and implement an action plan. I believe that nurses, patients, and families, as well as leadership, management, and human resources, should be involved in the change for anti bullying. The effectiveness of the culture change could be measured after 6 months by use of the support groups, zero tolerance policies, the ongoing education, and we should give the same survey in 6 months to see if there's been any improvement and what the areas that we've improved in. So once of that, we can implement the PDSA model, which is the Plan, Do, Study, Act model, which could implement rapid change, and it's cyclical. So we can continue to fix and implement things that would be beneficial to fostering that anti-bullying environment. Thank you so much, and this has been my presentation on reducing bullying and patient outcomes.